Hi everyone. This is another patient who recently came in complaining of this fullness under her right lower lid. As you can see, this area of enlargement here. She had had a prior lower lid surgery many years back overseas, and she was wondering whether or not that was residual fat or was it something different. Patient was referred, and during the consult, when I felt this area, it really did feel firm. It didn't feel like soft fat would feel. At that point, we got some imaging and we found out that she had a tumor there, some kind of a growth that wasn't consistent with a lower lid fat pattern. Watch this transformation. And now you can see this contour looks much more like this side, flatter, less full, better symmetry. And I approached this lesion the same way I do for lower lid blepharoplasty. We went inside her lid so as to minimize any scarring, and we're able to get around that tumor in its entirety. It was this whitish type of firm tissue that we saw, and it was nothing like the normal fat that we see when we're doing a lower lid blepharoplasty. So in her case, this was an orbital mass lesion looking like or mimicking the same effect as a bag under the eyes, and we were able to actually remove it and restore better symmetry in her case, and she's really satisfied now. So just to recap here, if you look at this before photo, looking like a lower lid bag under her right eye, and after we removed this mass, you can see the difference there. However, not everything that looks like a bag is a bag under the eye. In cases where it feels firm, when it's changing, when it gets red or inflamed or painful, these are all red flags to have it evaluated by an oculofacial surgeon to ensure that it's not an orbital mass that needs to be removed, as it was in this patient. Regardless, we do it the same way, approaching it from inside the lid to leave no scars and to achieve better balance between the two sides, as you can see in this after photo.